All all right, welcome. Thank you for being here for our Count the Kicks webinar with North Dakota. We're so excited to be here to bring you information today and talk to you a little bit more about our evidence-based education program. So I am Sarah Coleman, and I am the State Expansion Director at Healthy Birthday Inc. And my role is to provide education and to make sure that we're getting materials out and to receive feedback about that programming. And so I'm very excited to be here with you today. We are doing this webinar in partnership with the North Dakota Health and Human Services Department. We really appreciate their partnership in making Count the Kicks materials free in the state of North Dakota. And we'll talk a little bit more about that as we go today. We intend this webinar today to be a little more provider focused. So as you're joining us, keeping that in mind, that we are going to be hearing from some individuals in the field who are providers that talk about the importance of Count the Kicks. But this information is for all. So if you're watching this and you're not a provider, don't panic. You'll learn a lot about this program. We believe that through using Count the Kicks, we can save 20 North Dakota babies every year with your help. We want you to know that we've been in North Dakota and we've had this partnership. We've already been able to work closely with the Department of Health and Human Services and put our materials into the hands of many people. And we're just looking to expand that reach and make sure that we can do all that we can do to prevent stillbirths where they are preventable. So let me start this video, and if you don't mind giving me a thumbs up that you can hear, I just want to make sure we're all working today. This is a video from a nurse here in Iowa who's going to explain a little bit more about our program for providers.
Before I came to work at the health department, I was a labor and delivery nurse at one of the larger hospitals here in Iowa. So I know firsthand the impact that a stillbirth has on families as well as the providers. And I have also seen the situations where the woman has monitored her baby's fetal movements and has come in because she's noticed a decrease in those movements and that baby has been saved. So I know that it works, and I know that Count the Kicks make a difference in saving the lives of babies. I think anyone that takes care of a pregnant woman should be teaching her about how to monitor her baby's fetal movements. There was one time when a family had a stillbirth delivery, and as I was dressing that baby after it was born, I realized that that little boy was never going to ride a bike, and that little boy was never going to go to school, and that the parents would never be able to watch their son graduate from school. And even though you try to be professional and a little bit detached just to make it through your day, you can't help but be affected and know how important it is to prevent these stillbirths from happening.
So I really appreciate Kim's perspective and sharing that information. It does affect us. It affects every single one of us. And if we can do our part to get out there and talk about fetal movement monitoring, that may be the difference between life and death for one child. So let's talk about stillbirth by the number. So that we recently have updated our statistics from the CDC and noticed a slight shift, a positive shift, that actually we've seen nearly 1 in 175 pregnancies end in stillbirth. And so that is a change from just the data 2 years ago, which is 1 in 173. So we're making progress in saving lives. We also want to take note that there are some significant racial disparities that exist when we talk about stillbirth. And we know that individuals of color are more likely to be impacted by stillbirth, as you can see here from this graphic. And so we always have that in mind, addressing disparities in stillbirth prevention. You'll see as we talk about some of our materials, we've made adjustments. We want languages to be available. Our printable kick charts are free and downloadable. Those are all in different languages. And the app itself is in almost 20 languages now. And so we're really pleased to have equity at the center of our work. When it comes to North Dakota and thinking about North Dakota's stillbirth numbers, on average, 63 babies are lost a year due to stillbirth. And where does that compare to the United States? Well, the United States is that teal line in the graphic there. And North Dakota is that red line that kind of bounces around a little. The yellow line is actually Iowa's line. And the campaign for Count the Kicks was actually founded here in Iowa. And we saw a huge reduction, a significant reduction in our stillbirth rate, over 30% from the time of implementation. And this is the success that we're trying to help other states replicate. And so just keeping that data in mind as we go forward is we know that this is a proven campaign and that it can work. And so we're trying to duplicate that success. So what exactly is Count the Kicks? So this is evidence-based stillbirth prevention program. I'll go through that research here in a minute. We're focused on educating and empowering expectant parents. So we want them to understand that it is very important to track fetal movements in the third trimester at the same time every day for every pregnancy. And we empower them through the use of our app or printable kick charts. When they have that routine, regular kick counting session, we empower them to be able to say to a provider, this is different, something's wrong, the movement has changed, and advocate for them to be seen. And so that we can determine, does an intervention need to be done? Does a provider need to determine if an intervention needs to be done for outcome? So what is this research that I've talked about? Well, our founding study is called what we refer to as the Norway study. And as you can see there, the circled researcher, Dr. Ruth Fretz, she sits on our medical advisory board now. This study was done in the mid 2000s in Norway, and the focus of the program is similar to what we do today. Expectant parents were educated about fetal movement monitoring. They were asked to speak up. They were asked to come to the hospital when there was a difference after they spoke to their provider. And they saw a 30% reduction in the country's stillbirth rate. And so this is significant. This is what our founders of the Count the Kicks campaign based their idea off of. They wanted to try that out in Iowa. And so we set off to do that in the mid 20 teens. And we had that program success. And we've looked at data intentionally with the state of Iowa, with the researchers here. We actually have a couple more research articles that have recently been published. Here are the QR codes if you would like to scan that. And let you listen to Dr. Hazel, one of the researchers, about what he has to say about the campaign in Iowa.
We know that there was no other sort of public health campaign going on in Iowa related to stillbirth at the time, and we know there's a relationship between the activity of Count the Kicks and the changes in stillbirth rate.
Prominent stillbirth researcher Dr. Alexander Hazel led the study that shows birth outcomes improved when moms learned about Count the Kicks.
And I think there was no doubt from the data that we saw a massive jump in the app downloads when there was a TV appearance. And I think ultimately as human beings, we are hardwired to listen to stories. You know, you can hear people like me talk about data all day long, and after a while people's eyes kind of glaze over and you can see that you've lost them. If you combine that with a story from a mum who kind of, you know, as you said, narrated how her experience identifying that her baby wasn't well because it wasn't moving normally, and then someone listened to her, took it seriously, did the tests that were needed, the test showed that there was a problem and the baby needed delivering, then that people listen to that and it touches them somewhere that numbers just don't.
Research shows that in Iowa, when more moms used the Count the Kicks app, more lives were saved.
Count the Kicks has had such an impact in helping mothers believe in themselves and believe in that they know what's happening within their own bodies, and then their ability to talk to a doctor in a way that they'll listen to, that the mom does know what she's talking about, because it gives them the tools to be able to show to the doctor when there's been a change in those kicks.
The Count the Kicks app is a data download for your intuition. Paying attention to your baby's movements is a great way to monitor your baby's health in the third trimester. Download the free Count the Kicks app and get counting today.
So maybe you're downloading that app, maybe you've already had it, but I would encourage you to download that as we go through the presentation. We'll talk a little bit more in depth about it. One thing that it's important to note, if you didn't pick up on it, Count the Kicks was on Good Morning America in 2017, and that kind of started the storytelling aspect really picked up. And so we rely on storytelling. We listen to parents. Some of our ambassadors are stillbirth parents. Some of the stories that we hear are called baby saves. People who went into the doctor when they felt like something was wrong and their outcome was positive. They have a baby today because of that fetal movement monitoring. So storytelling is another aspect that's very important to us, and it's a way that we listen and respond to feedback. So again, in line with the research, we're very excited to share with you. This is brand new, brand new. We've just had it a week. The A1 practice brief has come out about fetal movement monitoring patterns. And we're excited because this mentions Count the Kicks and mentions the importance of fetal movement monitoring as a practice for nurses. And that's really important that we include that information as part of triage processes. So I'd encourage you to check that out. It's on our website. The key components align seamlessly with our prevention program, the takeaways that they have. And so we're really excited that that comes out and happy to share that with you today. So let's talk about what's happening in North Dakota. So here are some of the resources, and I have a QR code for you to scan today. If you'd like to go to countthekicks.org, I'm going to give us a minute to place these orders, and thankfully my wonderful coordinator has put the link in here in the chat for you. We will give you a minute to go on to see what those materials are. I'll play some music for you, and we will give away an Amazon gift card today I'm sorry, we are not giving away an Amazon gift card today. We have a different opportunity for you today. If you place an order today, this is the 18th. So we want to make sure those orders are getting in as you're watching this. So let me play some music for you here. Get that up, and we'll give you a minute to go on and order your materials.
It might seem crazy what I'm about to say. Sunshine, she's here. You can take a break. I'm a hot air balloon that could go to space with the air, like I don't care, baby. By the way, because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Well, give me all you got and don't hold it back. Well, I should probably warn you, I'll be just fine. No offense to you, don't waste your time. Here's why. Because I'm happy. Clap along if you feel like a room.
All right, I'm going to keep us moving. I got to make sure I get off mute. Hopefully you got a chance to look and see what our material offerings are in North Dakota. You've ordered some things for your practice. And just know that we have additional resources like the printable kick counting charts that I mentioned. Those are all available online. All right, so let me go through what are some benefits. So I keep talking about fetal movement monitoring. What are some benefits? Well, again, leaning into the research that we have, we did a study of our app users and compared that to a control population. And sometimes we get questions about anxiety. Will somebody monitoring their kicks every day have more anxiety? And the answer, according to research, is no. And you can see some of the statistics here. They felt less anxious. And also there was this feeling of bonding that was increased by doing this. And I just want to highlight, if you are a provider that works with WIC clinics, with home visitors, any kind of community health worker, that is something to really emphasize, when our home visitors in other states have contact points with parents, they suggest that if they have young children, that a perfect way to count kicks and include family members and make this a family experience for little ones is to do it while you're reading a book, and have your little one, your child, tell you when they felt a kick, and then you can make that adjustment on the app, or let them actually touch the app. There's a way to incorporate family relationships into fetal movement monitoring, and that increases bonding. So we would love to tout that as a benefit. Additionally, we've seen a reduction of preterm birth rate. If you watch the Baby Ruby story, our CEO actually had an experience of being in preterm labor. She knew it. She was being monitored, and she was able to prevent herself from having a preterm birth with seeking out that medical care. They were able to stop that. And she attributes that to using the Count the Kicks app. Also, fetal growth restrictions can be identified earlier. When that monitoring is done, if somebody comes in for a biophysical profile, they can see that, they can monitor for that and make adjustments to care plans. And then women who have stillbirths are at substantially higher risk for severe maternal morbidity. This is true. We know that have over women that have live births, regardless of the cause of fetal death. We actually have a white paper on our website that explores this link in a little more detail, has some research to back it up. And also, going back to that storytelling, we incorporate the stories of women throughout that paper that tell that story about how they avoided a significant negative outcome because they were doing fetal movement monitoring and because they were able to speak up to a provider. So there are additional benefits to fetal movement monitoring. And if you're interested in that paper, here is the QR code. You can scan that. You can see a little highlights here about the research. But again, we just want to point out that women at most risk for severe maternal outcomes may also be at higher risk for stillbirth based on their pre-existing or demographic characteristics and conditions related to stillbirth. So just want to have that in your back pocket as far as research. So talking about the implementation of Count the Kicks. So how does this happen in your practice? How do you know when you should talk about it? Well, we recommend, along with ACOG, that you begin counting at 28 weeks of gestation. If someone is pregnant with high risk or multiples, we recommend that kick counting begin at 26 weeks. This is when we know that there's a regular pattern that probably the expectant parent is recognizing. So this is a great time to do that. And what counts as movement? Well, everything except for hiccups. Hiccups are involuntary movements, and we're looking for those voluntary movements to really speak to how the infant is doing and responding. Sometimes we get asked about how does the baby respond? How do we know that this is a responsive practice? Well, recently I've experienced COVID for the umpteenth time. And when I had COVID, I noticed that I didn't want to do anything. I didn't feel good. I didn't have energy. I didn't want to move. I didn't want to do things that I normally needed to do or wanted to do. I just wanted to kind of hang out on my couch. And so that's no different when we think about infants that may be experiencing stress in utero. When you asked me to move when I had COVID, I could do it, but I didn't want to do it, and it didn't feel good. If somebody had given me a Dr. Pepper, my favorite choice of drink, I probably would have had some energy, but it was false, right? It wasn't what was really going on in my body, in my system. And so again, that's that practice and answering, responding to people who ask, well, how do we know? So let's talk about the app. We've talked about why fetal movement is monitored. The app. So this is kind of our hallmark feature. Maybe you've taken a minute to download it. It's available on Apple and Android. We have recently added several more languages and are in the process of adding more languages to our app. So we're constantly taking a look at the reach that is available to folks who are using the app. And as you can see here, this is very easy to do. And as you might have seen in the previous video, so all somebody does is they start a session and then they're just tapping the foot every time that they feel a fetal movement. And that counter will stop once you reach 10 movements. And then you can you can speak to the strength of movement. When you get to the second page of the app, which you can see here, it says the strength, the movement strength, and put any additional notes there. So if this is a different pattern of movement, if it felt weaker than it normally has, there's an opportunity for you to make a note there. And this creates this longitudinal perspective for individuals who are using the app. They must be registered to get more than 5 days of data. So we really encourage people, as you're talking to patients, encourage them to register with the app. We're not doing anything with their account. We're not selling it. This app is totally free, but we don't use pop-ups. We're not selling the information. None of that data mining is going on. And so this is simply for people to be able to use and speak to their provider about it. And if you have any questions about that, please go ahead and put those in the chat, or feel free to email me. I'll make sure that my email is in the chat for you as well. But we really want to make sure that people are using this app, and making sure that if they don't have the app, if they don't have internet for the app, they're using a pay-per-click counting chart. This is just a tool to help with fetal movement monitoring. All right, so I think I have one more message from you, from Dr. Ann Berry.
Hi, I'm Ann Anderson Berry, the Medical Director of the Nebraska Perinatal Quality Improvement Collaborative and the Chief of Neonatology at Nebraska Medicine, UNMC, and Children's Hospital and Medical Center here in Omaha, Nebraska. It is my honor to serve on the Medical Advisory Board for Count the Kicks. Count the Kicks empowers women to learn how their babies move in utero and prevent still death. This is a profound opportunity to decrease stillbirths across the country. Thanks, Count the Kicks, for everything you do.
Okay, so we've talked about the fetal movement monitoring importance, the tools to do it. Let's think about systematic implementation. And this is, we're getting to the back end of this presentation here. How can you integrate this into a system? So if you're a provider, you're a doula, you're a midwife, maybe you are a WIC clinic supervisor, the most important thing you can do is make sure everybody on your team knows about this. Make sure that everybody knows what Count the Kicks is, they know how to order materials, they know that they're free. Make sure that this webinar gets distributed far and wide so people can learn more about Count the Kicks. And then the next thing you can do is, if you have any paperwork or electronic health records, include Count the Kicks, include that touch point that you are talking about fetal movement monitoring with your patients, include that in the documentation. And so everybody knows, as I'm going through and I'm checking somebody in, oh, did I ask about fetal movement monitoring? Document that. That's really important. And that ties into the next step, which is discuss this at every parent touch point. So even at the very beginning of a pregnancy, you can talk about the importance of, as you move into this third trimester and as you learn about fetal movement in the second trimester, you start to feel those movements. It's important for you to recognize those movements and start to notice patterns about that movement. And when you get into that third trimester, that's the time to start doing the fetal movement monitoring. And then just the last step that we would encourage you to do is just spread the news far and wide. It is really important as providers in your community to stress how important fetal movement monitoring is. We talk about safe sleep, talk about the Back to Sleep campaign. Stillbirth should be no different. We should be talking about fetal movement monitoring as a preventative tactic, and knowing that we can make a difference in fetal and maternal health outcomes. And sometimes we get asked about misconceptions, and I just want to take a minute to address one of these here. You can see that there's multiple, and I'm sure you get questions about them, but I'll just take a minute to address one of them. So one of the questions that we hear sometimes is that my baby should get 10 kicks in 2 hours. And research has indicated that it's really important to monitor the strength and the intensity of that movement. That's the really important piece, that you know that you're getting strong, intense kicks, and just how long did it take to get to 10 of those kicks? It's not necessarily 10 kicks over 2 hours. Just what is the baby's normal pattern? By paying attention to fetal movement monitoring, you will recognize strength, intensity, and pattern of those kicks, but you've got to do it with every pregnancy, every single day at the same time, to really know that you have a pattern established. That's the most important part. So want to highlight that for you today. And then going along with the implementation, this is just an example. If you're somebody who's interested, well, after visit summaries, how can we talk about count the kicks? How can we incorporate that when a patient has seen us for an appointment? This is an example from a medical center here in Iowa. They actually just have a QR code and they have some talking points so that when a patient is checking out, this is the instruction that they get when they've been triaged. And so this is really important. If you are making a systematic change, that you incorporate this kind of information in some way there. So coming around to the end, let me tell you about some resources and then we're done for the day. So we have a Count the Kicks training. If you're interested in getting some CEs, you're interested in getting into the real weeds of the research and the campaign, we'd love to share this opportunity with you. It's recently been updated. And so feel free to scan this QR code. I will be sharing this presentation out so people have access to the slides afterwards. So don't worry if you missed it there. And then again, we just want to highlight that we have the materials available. We have tons of materials and a variety of materials available for the Count the Kicks campaign. And so just check out what's available in the North Dakota store and give us some feedback about that. And then if you'd like to know what's going on with us, we have a very active social media team and we have a fantastic newsletter. We'd love to share updates with you and share more information and get to know how this is working in your state. So would love to have you do a part of that. And I just want to close out with the story. We, again, talk about storytelling. This is the story of baby Nala. This is a baby safe story, and I think it's pretty impactful. So let me share that with you. And then I'll come off and see if there's any questions in the chat.
She came back in after she had me put on the monitor and stuff, and she's like, we're just going to take her. And I'm like, what? And she's like, her heart rate is dropping every time you have a contraction. I was already scared, because I was a high-risk pregnancy. So I basically learned from the doctor's office, the little yellow sign that was right there. Once she started moving, I was very alert with her movements, That was what I lived for, just because I wanted her to, her to make it and survive. When she started moving, she moved, and she was consistent. It was always at a certain time. Nala was a kicker. When she started kicking, she was kicking. And this day, she wasn't moving at all. I started drinking cold water. I was drinking so much, my stomach was hurting to make her move. And she didn't move at all for me at all that time. So I'm just like, okay, I'm going to get her checked out. It was the heart rate that was dropping. Like they said, her heart rate would drop real low every time I would have a contraction, and they were like back to back. She thought that it would save the baby, so she pulled her out. She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if? Definitely to pay attention and count the kicks, I feel like it's important just because had I not, knew to do that, Nala wouldn't be here. Don't second guess yourself. Don't feel bad or stupid. Don't worry about insurance or the emergency room bill. Go check on your baby, because your baby might not be here. You just pay attention, seriously, like it's your baby's life.
All right, so that is baby Nala's story. And thank you again for the opportunity to share information with you today. I want to thank again my partners at the North Dakota Department of Health and Human Services. So at this time, I'll just see if we have any questions in the chat. Again, everybody's muted as we're recording this. So go ahead and throw any questions in chat and I'll just hang out here for a minute and see if I can answer anything. Otherwise, have a great day.